Hello, everyone. Today we'll be presenting our group presentation, Bridging Pain and Cognition, a multimodal approach to managing chronic musculoskeletal pain in older adults. This is for our evidence-based research class for the University of Texas of El Paso College of Nursing. This is by Annevay Fernandez, David Beyl, Luis Ao, Raquel Vera, and Ruby Santos. The goal of this presentation is to demonstrate how evidence-based research can be used to evaluate and improve clinical outcomes for older adults experiencing chronic pain. Hello. Here is a brief outline of what we will be covering today. First, we'll give you a general introduction to the problem of chronic musculoskeletal pain in older adults. Then we'll introduce our case study, followed by the PICO question that guided our research. And then we will walk you through the search methods we used, discuss 3 studies we identified, synthesize the findings, review the nursing implications, and conclude with final thoughts. Chronic musculoskeletal pain, or CMSP, is one of the most persistent and disabling conditions affecting older adults. It is typically defined as pain lasting more than 3 to 6 months, originating from bones, joints, muscles, or connective tissues. What makes CMSP especially concerning is that it often is accompanied by other issues such as cognitive decline, reduced mobility, depression, and decreased quality of life. According to Da Costa and colleagues in 2025, chronic pain has a significant negative association with cognitive abilities in older adults, with specific impacts on memory, attention, and language. That finding is consistent with what many clinicians are seeing. Pain doesn't just affect the body, it also affects the brain, behavior, and an individual's ability to function independently. Despite this evidence, pain in older adults is frequently undertreated or treated primarily with medications, without incorporating cognitive or self-efficacy based approaches. This gap in care led us to explore potential of using a combined approach to pain management. So why does this matter specifically to us as nurses? Nurses play a critical role in the assessment, management, and education of patients with chronic pain. Older adults often underreport their pain or accept it as a normal part of aging, which means the nurse must actively screen and advocate for better care. Left untreated or poorly treated, chronic pain leads to decreased mobility, lower motivation, increased fall risk, and even high rates of hospitalization. When chronic pain affects cognitive function, it creates additional barriers to self-management. As nurses, we need to understand that pain management is not just about treating the pain. It's also about maintaining a patient's cognitive health, emotional well-being, and functional independence.
Okay, so to get a better understanding of the whole thing, we're gonna go into the case study. So our patient with the initials MG is a 74-year-old female patient who fractured her hip over 18 months ago. This patient since then has been experiencing continuous pain, difficulty sleeping, reduced concentration, as well as limited mobility. She's able to perform activities of daily living by using a walker. Her participation in therapy and physical therapy has decreased, which has made her feel frustrated and discouraged. Her pain is being managed by non-opioid analgesics, which is not enough for her pain. Her healthcare team believes that her pain is then affecting her cognition as well as her self-efficiency, meaning that her belief in her ability is to manage her pain and take control of her pain and health, which led us to develop our PICO question. So I will be talking about that next. Okay, so now I'm going to talk about our PICO table. So as you could see, our PICO table is summarized in a table. So our population is older adults with chronic musculoskeletal pain. Our intervention consists of the comprehensive pain management that includes both self-efficiency training and cognitive support. Our comparison is normal or limited care, meaning that pain manage is focused solely on medication. The outcome we are focusing on is cognitive function, self-efficiency, as well as quality of life for the patient that is dealing with the pain. Next, we'll be talking about the PICO question. So that's going to be the next slide. Okay, so we are now going to talk about the PICO question. So our PICO question is basically in older adults that are suffering from musculoskeletal pain, how does comprehensive pain management, including self-efficiency, training, and cognitive support, as well as compared with normal or limited care, affect self-efficiency, cognitive function, and quality of life? Now we're going to talk about the search methods in the next slide. Okay, so now I'm going to get into the search methods that we used in order to get our answer for our PICO question. So we conducted a structured database research. So in order to do this, we did use 4 healthcare research databases, which included CINAHL, PubMed, Web of Science, as well as Scopus and Mobilize Boston Study. We did use some keywords and phrases, which included chronic musculoskeletal pain, older adults, cognitive decline, as well as pain self-efficiency and pain management. So we combine these terms with Boolean operators, which include the following words, so and or not. That way we can get a more specific answers. We also set filters, limiters. So we did filter for peer-reviewed articles, the English language, of course, and then publication dates that were no more than 5 years. This way, these filters helped us in order to narrow down our answers and made us be able to get the most updated, most relevant, and current search available for us. That way we can get the best answer possible for our PICO question. So now we're going to go on to the next slide.
Boolean search example. Here is an example of how we use these terms in a database search. Chronic musculoskeletal pain in older adults and cognitive function or self-efficacy and pain management, not acute pain. This type of Boolean query helps refine the search and ensures that our results match the specific components of our PICO questions. Evidence-based overview table. These are the 3 studies we selected for evidence appraisal and synthesis. The first is a systematic review and meta-analysis by the Costa and colleagues in 2025, which provide level 1 evidence. The second is a quantitative cross-sectional study by Sujasi et al. In 2025, which is a level 4 evidence. The third is a qualitative study from Law and colleagues in 2019, which is level 6 evidence according to Johns Hopkins. Study number 1, the Costa et al. 2025. The first study conducted by the Costa and colleagues examined the relationship between chronic pain and cognitive function in older adults. It included 10 studies with a combined total of 2,427 participants, mostly between 67 and 78 years old. This meta-analysis concluded that there is a significant association between chronic musculoskeletal pain and cognitive decline, Specifically, individuals reported lower performance in language, verbal fluency, visual-spatial recall, and attention. This suggests that chronic pain is a risk factor for cognitive impairment in aging population. The authors recommended routine cognitive assessment for older adults presenting with chronic pain. Study number 2, Suyasi et al., 2025. The second study by Suyasi and colleagues investigated the relationship between cognitive performance and pain self-efficacy in community-dwelling older adults. The study involved 458 participants aged 70 and older and used self-report measures to assess pain and cognitive function. The results showed that higher cognitive function was significantly associated with better self-efficacy in pain management. However, adjusting for multiple comorbidities, the association was no longer significant. This suggests that other factors, such as health condition and functional ability, may also affect a person's confidence in managing pain. This study underscores the complex interaction between cognition, pain, and self-management. Study number 3, Law et al., 2019. Our third study by Law and colleagues used qualitative methods to explore the pain experiences of older adults in Hong Kong. Through interviews, the researcher found that many participants relied on culturally familiar self-care strategies, such as using ointments, stretching, tai chi, and massage. However, many also expressed frustration with rushed clinical visits and lack of follow-up care. This study highlighted how chronic pain is not just a physical problem, but an emotional and social one. It also illustrated the importance of culturally sensitive care and the need for patient autonomy in pain management.
Synthesis of evidence. Across all 3 studies, several themes emerged. First, chronic pain is strongly linked to cognitive decline in older adults. Second, cognitive function plays a role in a patient's ability to manage their own pain. Third, patients often seek alternative and self-directed strategies when clinical care is insufficient. Taken together, these findings suggest that effective pain management requires addressing both the physical and cognitive aspects of pain, while also supporting patient autonomy. Nursing implication number 1, comprehensive pain assessment. The first nursing implication is the need for a multidisciplinary and comprehensive pain assessment approach. Nurses should not only assess pain intensity on a scale of 0 to 10, but also screen for cognitive impairment, sleep disturbance, depression, and functional ability. Tools like the Mini Mental Status Exam or Montreal Cognitive Assessment can be used during routine assessments.
Nursing implication number 2, patient education. The second implication is the importance of teaching non-pharmacologic pain strategies. Nurses should provide education on techniques such as mindfulness, stretching, sleep hygiene, heat therapy, and graded exercise. This builds self-efficiency, which research has shown to improve outcomes in chronic pain. Nurses should also reassure patients that it is okay to try new pain management strategies, especially when medications alone are not working. Nursing implication number 3, interdisciplinary collaboration. The third implication is that nurses play a vital role in facilitating interdisciplinary care. Chronic pain often requires a team approach involving physical therapy, psychology, social work, and primary care. Nurses can coordinate referrals, communicate patient goals across the team, and ensure follow-up care. Collaboration not only supports physical recovery, but also promotes emotional and cognitive resilience, especially in older adult patients who may feel isolated or overwhelmed. In conclusion, chronic musculoskeletal pain impacts more than just physical health. It has meaningful effects on cognitive,
self-efficiency, and overall function in older adults. The evidence supports a comprehensive, multimodal approach in pain management that includes cognitive support and self-efficiency training rather than relying on medication alone. As nurses, we have the responsibility to address pain from a holistic perspective. By incorporating cognitive screenings, patient education, and interdisciplinary collaboration, we can improve patient outcomes and quality of life.